So this is a model of a human heart. It's approximately 1.5 times the size of the human heart. I'm going to cover all of the structures that can be seen on this model, and I'll do that in the direction which venous blood would return to the heart before it becomes oxygenated in the lungs, and then how it would return back as arterial blood to the other side of the heart. So to begin, we have a return that is superior to the heart called the superior vena cava. This would be draining blood from up above the heart in the body. And then we also have a return called the inferior vena cava, and the inferior vena cava is just depicted down here as this little hole right there. And both of those are returning into the right atria. The other return that we have is we have right there the coronary sinus, and the coronary sinus is going to be draining deoxygenated blood from the myocardium. So returning from the coronary sinus into the right atrium. Now the right atrium is going to have a boundary between it and the right ventricle, and that is going to be called the atrioventricular valve on the right side of the body, or the tricuspid valve. So right there you can see the tricuspid valve, and we'll get a better look for that as soon as I remove this anterior wall of the heart. So this is going to be the wall of the right ventricle as well as the left ventricle. And with that removed, first I noticed the tricuspid valve, so made up of 3 different cusps there. These structures are called the chordae tendineae that are connecting to each of these cusps of the valve, and those are going to insert onto the papillary muscles. So the papillary muscles are going to be extensions of the myocardium that actually can exert tension on these chordae tendineae to hold this valve shut when the ventricles contract. So it's a unique structure to the atrioventricular valves, the chordae tendineae and papillary muscles. Now, noticing this wavy structure inside the heart here, that is called the trabeculae carneae. And the trabeculae carneae is just a formation of the myocardium that allows us to direct the blood flow in the direction that we want to go. We have a similar wavy appearance up here to the atria, and that's called pectinate muscles. So really about the same type of purpose, but different names. Now, this layer shown here is the endocardium. The endocardium is actually a continuous layer of simple squamous epithelium that actually extends all the way through the cardiovascular system down to the capillary beds. Just back behind there, or deep to that, we see the myocardium. So the myocardium is going to be made of cardiac muscle, of course, and that is the functional tissue that allows us to contract the different chambers and then direct blood the way we want it to go. Now from this right ventricle, when that contracts, we basically will be pumping blood past this pulmonary semilunar valve into the pulmonary trunk. And the pulmonary trunk is going to bring blood out to both the right and left lungs through pulmonary arteries. So remember, arteries always carry blood away from the heart, while veins always carry blood towards the heart. And in this case, arteries are carrying deoxygenated blood. So that's the only time where we have arteries carrying deoxygenated blood. So in the lungs, the blood would of course become oxygenated, and then it's going to return through pulmonary veins. The pulmonary veins are depicted back here and here, and those pulmonary veins are going to drain into this left atrium. So the left atrium is where that arterial blood is returning, and then when this left atria contracts, what's going to happen is the bicuspid valve will open. So this is the atrioventricular valve on the right side of the body, also called the bicuspid or the mitral valve. And getting a different look at that down here, we can see the structure is the same with the chordae tendineae connecting to those cusps, which then connect to papillary muscles in the ventricle. And when that left ventricle contracts, that is going to push blood out through this valve right here, which is the aortic semilunar valve. So now just notice the difference between these atrioventricular valves with the chordae tendineae and papillary muscles, and then the semilunar valves that are just basically cusps. So structural difference there between the two different sets of valves. When we pass through this aortic semilunar valve, we've then entered into the aorta. And the aorta has three branchings up on this aortic arch. So first we have the brachiocephalic trunk. That is unique to the right side of the body. So we only have one brachiocephalic trunk in the body. Then we have over here the left common carotid and the left subclavian artery. Now, this brachiocephalic trunk, very soon after this point, would also branch into a right common carotid and a right subclavian.